talk about submental fat.
What a great topic.
This is I know. This is the area where people come in, we want to fill, we want to fix everything up top, and we're left with the jaw and the neck.
Yes, it's the one area we can do so little about, and we kind of work around it sometimes because women tend to lose their chin. It recedes as we age, and so by reflating the chin, by recontouring the jawline, by lifting with Ulthera, we can have some impact in minimizing the appearance of that submental fat. But this is a problem for men as well. That turkey neck, they really hate it. And unfortunately, I just noticed that if I can't affect something like the turkey neck, basically, I tend to not pay attention to it when I'm analyzing a patient. So one thing I try to do is push myself to do a complete analysis, even of things that I can't affect, and then explain that to the patient and say how I can work around it. But when it came to that, I would just send patients out to a plastic surgeon.
Right.
So the idea that we can have a treatment now that can potentially, non-surgically, melt the fat under the neck and work well with the fillers that we're doing in the jawline and the chin, with the Ultherapy or Thermage treatments to help tighten and lift that area, I think we kind of have a win-win situation for our patients.
I think so too, and I think it's exciting also because this is sort of off label, but there's also discussion about taking it elsewhere.
Yes.
So we all want the arms.
Yes.
We all want all the other possibilities, fat pads, everything else. So
the inner thighs. Let's just keep going. I just keep thinking of more places.
Thinking of different parts on the body.
I'll stop thinking.
Exactly. So so as a molecule that can essentially cause fat resorption, dissolve fat, and then cause fat resorption.
Yeah.
I've been very impressed by the results with ATX-101. I think they're very impressive. There has always been the concern about taking away too much.
Right.
Because that's always a risk. Controlling dosing is a question. I think that's still being worked out.
Yeah.
But I agree with you completely, and I think it's kind of a very valid point that when we're looking at an area like the jaw, we really do have to look below the jawline to get a complete aesthetic unit.
And now we're even moving down further because Ultherapy was just approved for the décolleté region.
Right.
So now we can, smooth the neck. It used to be that you look at someone's face and say, oh gosh, they look great. Then you look at the neck and chest, go, oh no, they're really 90.
Yeah.
So now we can actually start moving our way down. And
it
became a matter of concealers and bronzers and being creative with scarves, basically, to hide those areas that we didn't like. But now, with the advancement of technology. And I am excited about ATX-101, and the most important thing I think for this company is going to be education. Education of staff, of physicians in how to do the treatments for patients, that it's not a no downtime treatment, that there is going to be some discomfort after the treatment, that it will take time to see the full results. And I think what you said is the most critical point, that you don't want to overdo it. So it's treat, assess, wait, assess again before you retreat, because I think a hollowed under the neck is more aging than having a fullness.
I agree.
Yeah.
I agree. Thank you,
Then you
Doris.
must be right.
Yeah, well.
If we agree, this is perfect.
It is perfect. Thank you very much. That's great.